What is the One Big Beautiful Bill, and how will it affect reproductive justice? On July 4th, President Trump officially signed the One Big Beautiful Bill into law, cutting taxes for the wealthy while eliminating federal welfare and health programs, reducing clean energy incentives, and restricting access to Medicaid. So, let's talk about what this means for reproductive rights. The bill includes a provision stating that it prohibits Medicaid funding for any health services covered by Planned Parenthood, essentially defunding clinics all around the U.S. and limiting family planning services, STI testing and treatments, and cancer screenings for 70 million Americans with Medicaid. Additionally, according to the National Women's Law Center, by telling insurance companies that they can no longer receive federal funding if they provide coverage for abortion services, the bill creates a massive incentive to drop coverage for any reproductive health care. The cost of an abortion can be incredibly expensive without insurance, reaching to prices over $1,000. This leaves millions of pregnant people unable to afford an abortion, particularly those who are already experiencing barriers to access, including people who are Black, Indigenous, immigrants, young, are low income, have disabilities, live in rural areas, or are LGBTQIA. This bill was passed by U.S. senators in a narrow 51-50 vote, broken by a tie by the vice president, and a 218-214 vote in the House. These few votes have created a tidal wave of problems for people all over the U.S. So, I urge you to vote. Whether it's presidential, state, or local elections, vote. It makes the biggest difference when our lawmakers are dictating what we can do with our bodies and whether or not we have access to healthcare.